Welcome, everyone, and greetings from an unseasonably warm day in Brooklyn. I hope you're doing well. My name is Michael Grilla. I'm the president of the Society for Health Communication and head of public health and social impact for About Kind, a global health communications agency. The Society is delighted to be partnering with the CDC Foundation and About Kind for our third webinar of 2013, CDC Moving Forward, What It Means for the Future of Health Communication. I'm thrilled to be kicking us off today as we discuss a topic of critical importance to health communicators, as demonstrated by our record-breaking 800 registrants today. So welcome, everyone. We're feeling very lucky to have avoided a government shutdown this past week, and so we're here as scheduled. Very briefly, I'm going to share some background on the society, go through a few housekeeping items, and then we'll go ahead and get started. Next slide, Erica. The Society for Health Communication was established in 2016 to unite professionals from across the field of health communication. We're now more than 4,500 members strong and growing, working to share resources, exchange best practices, and advance the evidence base of the field. Now more than ever, our work is critically important. So if you're not already a member, we encourage you to join the movement. It's completely free. You can sign up on our website. Our executive leadership team includes myself, our Vice President, Ashani Johnson-Turbis, Member at Large, Stacey Robison, and our Executive Director, Diane Brodalski. The Society also includes an esteemed group of leaders from across sectors who make up our steering committee and our advisory board, and you can learn more about them on our website. And of note, we are currently recruiting for our 2024-25 steering committee term, which you can also apply on our website until October 31st. Next slide, please, Erica. So just a quick few housekeeping items. Everyone is automatically muted. But you have the chat function is open for conversation. I've already seen some things popping up there. Please to join the conversation. Today's webinar is being recorded, as you can see, and will be made available on the Society website, along with the slides that are going to be presented from our CDC colleagues. So if you're looking for to share this with colleagues, as well as the slides, which I know people often are, those will be available on the site in the coming weeks. We will leave a few minutes at the end for a live Q&A. So if you have a question, please submit that through the Q&A function. We will not be monitoring the chat for questions. So just a reminder to use that Q&A function for questions for our panelists. Closed captioning is turned on and available, and you can send direct messages to tech support if you have any technical questions or issues, or email my colleague, Erica. And with that, I'm very excited to hand it over to our moderator, Kenitra Joseph, Campaign Director at the CDC Foundation. So thank you again for joining us, and take it away, Kenitra.
Thank you, Michael, and welcome, and good afternoon, depending on where you're joining from. Good morning. Today, it is my pleasure to moderate this meaningful discussion. As Michael noted, and as we'll learn more about today, CDC Moving Forward is about transformation through modernization and innovation. And that's something that would not be a small feat for a small organization. So as you can imagine, it is all the more significant for an organization of CDC's size, scale, and scope. While CDC Moving Forward is an organization-wide effort that covers multiple aspects of the agency's processes and operations, today's webinar will focus specifically on the communication pillar of the initiative. The fact that it is a core pillar is, in and of itself, a testament to the agency's appreciation and recognition of the importance of communication. So I'm looking forward as a health communicator to learning more about what that could mean for me, and as I'm sure we all are, what it can mean for us in our roles in the future of our work in health communication. Who better to share insights than two of the leaders directly charged with leading the communication priorities in CDC Moving Forward? I'm so pleased to be joined by Carol Crawford, who is Director of Digital Media in the Office of Communications at CDC, where she's worked for more than 30 years and has established herself as a government leader in digital communication. In CDC Moving Forward, Carol is leading the Herculean charge to update and modernize cdc.gov. Betsy Mitchell, who is Director of the Division of Communication Science in the Office of Communications at CDC, is joining us as well. For nearly 2 decades, Betsy has held numerous senior level positions at CDC. Among many areas she is helping to lead in CDC Moving Forward, she oversees the agency's efforts to operationalize its focus on plain language communication. Betsy, Carol, thank you so much for joining us all and sharing your insight today. I'd like to begin by asking you to help set the stage with an overview of the communication components of CDC Moving Forward, starting with you, Betsy.
Wonderful. Thank you. It's so great to be here. What an honor. Over the past year, as you were sharing, we've done a lot of reflection, visioning, and prioritization for the future through the agency initiative called Moving Forward. This has involved intensive listening and interdisciplinary collaboration, assessment of where innovation is possible, and reimagination of the way we work and accomplish our goals. CDC Moving Forward really is transforming the way we work as an agency in 5 critical areas: sharing science and data faster, translating science into practice, prioritizing public health communications, developing a CDC workforce ready to respond to future threats, and promoting results-based partnerships. And so today, Carol and I have the pleasure of sharing a couple of examples about how CDC is prioritizing public health communication. Next slide. And so I love this video. I think it makes the point really well. I'd love to share this clip with you if we could roll the video.
At TRICOM, we've developed a topical hydrogel. It inhibits activation of epidermal nerves sending pruritus signals to the brain.
He means it stops itching.
If aculicidae penetrates the dermis,
mosquito bite,
or xeroderma triggers keratinocyte-induced pro-inflammatory cytokine release.
Dry skin, itchy.
Without glucocorticoids, TRICOM suppresses the nociceptors that encode...
No steroids. What? TRICOM, itch, burn, sting, gone. Ooh, I gotta move my car. Come on, honey.
Who was that?
I bet a number of you are nodding right now. As health communicators, this is the dynamic that we often have. We are working with our scientists and we have a want for clear communication. Certainly the COVID-19 pandemic reinforced the importance and need for communicating science clearly. In my division, we've been focused on developing and implementing a multi-pronged plan to help the agency communicate science clearly with a focus on the public. So taking our data, our guidances, and ensuring that they're clear and understandable to the general public. And you see the components of our approach here. We've got a training and education component focused on scientists and senior leaders, a multidisciplinary collaboration arm, system integration, vis-a-vis digital modernization, and of course, accountability. Next slide. And in the big picture, there are so many reasons why communicating science clearly is critical. One, it lets a broad audience understand our science, what we're trying to convey. The public wants to protect themselves and their loved ones, and providing easy to understand scientific information allows for people to act on what we're conveying. It's the law, it builds trust, it saves lives. Next slide. And in our trainings, it's been really important to convey that most people have trouble understanding health information. Next slide. And as public health communicators, I know we all, in our dissemination plans and communication planning, we work with influencers or third parties to help amplify our messages. And it's important to remember, and we've emphasized this in our trainings, that we have to be clear from the get-go that, for example, with media, we can't depend on them to translate our science for the public. When the media gets it right, they can help us for sure. But for the most part, and this particular study, the footnotes in the bottom, shows that scientists, they're not steeped in science, and they too want clear communication to be able to further disseminate. Next slide. There are many important principles for good public health communication. And as we've approached this internally and thought about, what is it that we want to train our scientists on? We focused on these principles noted here. Knowing your audience. So talking about formative research, audience segmentation, understanding the psychology and where audiences are coming from, unpacking that with them, putting the main message first, keeping our language simple, using clear, everyday, understandable language, telling a story. So taking what might be dry and number laden and making it relatable to people. And then importantly, communicating with empathy. A lot of what we do and how we're communicating is in the context of risk or uncertainty. And so certainly people want to know that we are centered around what their experience is. So these are some of the principles that we have been approaching in the training. And we've also, just to point out as well, it's important as we've approached our scientists to ensure that they understand that communication is a science, and that the principles that we're talking about have an evidence base to them. So we're coming as peers in this training situation. Next slide. And as we've talked about the why with our scientists and our senior leaders, we're reminding our colleagues that behind everything we do, we want to be audience-centered, that the public is busy, and we need to reach them in ways that are effective and that will resonate with them. In our trainings, for example, we show clips from formative research with the public, some pretest of web content that we've done and have permission to share. And it shows where the public may be struggling with some of our content and could be made more clear. And the woman that you see in the center of this slide is a persona that we've woven throughout the training. We use a secondary data set to develop a persona for her. We call her Mary. She's a manager. She has 3 children. And so woven, again, throughout the training is her experience, her needs, the perspective that she's bringing, which I think helps to make the experience more tangible. Next slide. And as we've been thinking about our audiences, we also have been very focused on who it is that we're training and the experience and the training that they have and that are coming to the table with. So, for example, we have to recognize that there are differences between how our disciplines are hardwired. Our scientists and communicators, there's a paradox between how we develop and present content. We know how important it is to convey the bottom line up front, or the main message at the top of whatever it is that we're communicating. And so this is a focus for skill building in this training. And as communicators, we know that audiences are skimming content, and we have just a few seconds to reach them with hopes that they'll attend further. So our training and exercises kind of dig into this a little bit as well. Next slide. As well as we've reinforced when to think about audiences, and we've been thinking about the so what in the work that we're doing together. And so for our scientists, helping them to understand that it's important to think about the public and what's in it for them at the very beginning, early on. So when they're thinking about setting their research agenda, when they're conducting their analyses, who are the audiences that will be impacted by the study that you're working on or the public health problem that you're working on? So that's been an important point of emphasis. Next slide. And we've imparted that good strategic communication happens when all legs of the stool come together early in a process, when we all have respective lenses and expertise that come early to the table to strategize. Importantly, communicators need to be at the table from the beginning. And in some places around CDC, this is happening really well. But for places where this could be better, we have been shoring up this point in our trainings, this multidisciplinary, bringing communicators in early to the process. So to close, in the big picture for this component of CDC Moving Forward, staff from my division have developed and are implementing a series of trainings for scientists and senior leaders that convey and train participants on the principles that I shared with you. We've reinforced early strategic communication to help continue with capacity building and culture change. We've developed a process for clear communication champions. So we have champions identified from both the comms and the science lanes. We're developing an agenda, and it's our hope that efforts continue so the capacity building continues across our centers, institutes, and offices. And so we can have a sustained effort over time. We're baking in clear communication into systems, and Carol's going to be talking about digital modernization next. And importantly, we've been highlighting successes, because there are certainly successes from across the agency, and building in accountability into the implementation process. So with that, I'll pause and I'll be happy to turn it over to Carol. Carol?
Thank you, Betsy. I appreciate it. And I'm really excited to get to come and talk to you all about what we are doing for CDC.gov. As Betsy mentioned, there's a lot of aspects of CDC Moving Forward, and we had been working on a modernization project before CDC Moving Forward came up, and this just allowed us to expand what we were doing for CDC.gov into what we call clean slate. And it's just a bigger, more innovative project now. So next slide, please. In the spirit of the bottom line up front, I was glad to see that on your slides, Betsy, because the bottom line here is that we're going to relaunch a completely new CDC.gov in spring 2024. Revamping the whole thing. It truly is a clean slate, which is kind of an old term, which is funny that we use that for digital, but a clean slate, everybody knows what that means. So it's been exciting to think that we could think of CDC.gov with that clean slate, because you don't have many opportunities in your career to really just start something over and relaunch it. And that's what we're doing here. Next slide, please. But before I get to the exciting spring of 2024, let me just back up and talk a little bit of how we got here. So we really had started this modernization project 2-3 years ago at the end of COVID. There was a lot we wanted to do, things that we had known about before, but that cropped up even more evident during COVID because of the size of that response and the web content and the demand for the web content. So what we did was a major internal review. We looked at how we were currently delivering information, thought about accuracy, timelines, all sorts of issues that we had been keeping a list of internally. Then, of course, we did a major external review, and this is beyond other government agencies. We really wanted to look out across the industry and see what are the best practices for delivering and managing content like we have at CDC. And we're unique because we have so many topics and a lot of content that's really decentralized. Then we really thought about some of the sustainability challenges that we had encountered before COVID, but definitely during COVID. I mean, we have a massive site currently, over 200,000 pages. It's hard to keep it all updated. It's hard to review all that annually. So these were things we were also really looking at. But mostly, we really wanted to think about the audience. What did the users need from CDC.gov? What did we need to deliver for both our public and professional audiences? So we did a lot of planning on that front. Next slide, please. And then, of course, the whole component of this is improving communication. That's why we're doing the relaunch of CDC.gov. So we really were thinking, what do we need to have our processes and our content deliver? What makes this better communication? And how can this project help create content that gives people what they need? Because the website is a major way that people receive communication from CDC.gov, from CDC, sorry. Next slide. So as we embarked on merging clean slate and merging what we were already doing with modernization, this really took two tracks for us. One is that end user track. So clean slate, we realized that we wanted to really start over. And so that meant we needed to assess the content that we had out there. And so we wanted to keep content that we knew users need via metrics, or we had clear call to actions or clear purpose of the content. By cleaning up and removing content that we didn't need anymore, that we couldn't keep updated, or that wasn't being used by audiences, helps us save time, but it also helps our users save time. They don't have to wade through a lot of content and other things that they don't need anymore. And we did a lot of reviews and performance audits, and people in the centers and our divisions thought about, why does someone need a piece of content? Does this match our strategic priorities? And we really thought about what we would do with the content and what people would be looking for. One part of Clean Slate is that when people start developing new content for CDC.gov, they should have been doing this all along, but the system's going to force them to identify what the communication goal, identify what the audience is, and say, what do you think a user's trying to do when they come to this page? And then the system will tell them, hey, did you know there are 4 or 5 other pages at CDC that already does that? So that they can not only think through strategically, why are they creating this before they start drafting content, they can also see how it fits in the ecosystem. And that ought to help us serve our users and our audiences more, and help us with some of those sustainability challenges that I mentioned before. Next slide. Then we married that focus on, next slide, sorry. Married the focus for Clean Slate to clean up the content and improve the content with what we were already doing on modernization, which was that process. So we took what we found in industry and we created some new systems for managing and developing our content. We had to be sure this is going to work for daily operations and emergency preparedness. And a real cornerstone of this is being sure that the way we publish our content and manage our content is more efficient, and it allows us to automate. Currently, on the existing CDC.gov, while we automate big components, we have a web content management system and things like that. Navigation is manually maintained. Lots of things are manually maintained and distributed throughout the center, and that just takes up a lot of resources, and it doesn't allow us to automate. And automation is going to allow lots of future opportunities for us. So that was really important for us to get into the system. Next slide, please. And then we wanted to marry this concept of baking in our digital and communication science into the system. We wanted everything that we were doing to be based on research, to be user tested, and to be based on data, and apply this across the agency so every topic and every program that we're working on at CDC could benefit from this basically being baked into the web process. Next slide. So what this is going to amount to is a couple of different things that you're going to see on CDC.gov in the spring. You're going to see a lot less content, consolidated web content, hopefully with that tip of the pyramid that Betsy showed, where the bottom line's up front and then we build. We're going to be able to tailor views. For instance, by using some automation, someone could find the list of everything CDC has for infection control nurses. This is not something that we can do very easily today. We're going to clean up massive navigation across our site to simplify. It confuses users. We have all these choices. That 73% of people that come to CDC.gov just want one page. They don't want to be presented with every possible option, and that causes confusion from our user testing. One of the biggest things that we're doing is, and the biggest culture change, is we're introducing consistent content structures across the site. So we're user testing, say, every page on treatment will look very similar across CDC. There might be some differences between maybe an infectious and a non-infectious treatment page or something like that, but they are going to be consistent. This consistency means that we can user test, we can have the best of the best based on digital science and leverage it across the agency. We don't have to reinvent the wheel. And we can use automation. So it's getting us a lot by being consistent. I think it's going to make the site a lot easier to use. And then the system itself is going to help us do a lot of what Betsy was talking about. It's when you develop content in our new systems, it's going to say, you've got too many bullets. This is maybe not plain language. Here's your content score. So it can really help us improve. And just like Betsy, we're telling people that are developing web content that when we use our tests with doctors, They really prefer our consumer content. They want it just as simple. And so this is something that we're trying to do. So I hope that you will look forward to seeing the new CDC.gov come in March. And I'm looking forward to answering your questions during the rest of the session. So thank you.
Thank you, Carol. Thank you, Betsy. In a word, wow. So like that, within each of your overviews, I know I'm sure we can all appreciate there's probably 2 to 3 webinars worth of content and really meaningful conversation in each of your overviews. So thank you so much for that. As before we dive into some of our own conversation, I want to underline that we have the opportunity, we're hearing from you while we're still in this journey, right? So you're able to share with us an overview now, some really meaningful insight into where you are and what you're learning, but we'll have opportunities to kind of track maybe along the way and imagine as you're well underway with this communication work in CDC moving forward. So thank you so much again for sharing with us. Betsy, I do want to start, we're going to double click on some of what you shared, but before we do that, I want to start with the why behind all of this. So kind of what prompted CDC to take this on and why now, given the effort that it does entail?
Yeah, thank you for that question. And, you know, we've been focused on plain language, clear communication. We've got a multitude of trainings, and I know we can drop those links in the chat for our viewers. But I think an important why and why now was really our experience during COVID-19. It was a very complicated emergency response, nuanced, evolving science, and CDC received a lot of criticism. And so after emergencies, we have what are called hot washes in our emergency speak. And so it's sort of a normal part of the process to unpack lessons learned and document those and develop action plans. So moving forward sort of came into that space. It was a very condensed timeline, expectation of a real sprint here, and it allowed, moving forward, has allowed for process and staffing and timelines to do the work. We had leadership from Dr. Walensky. She was a champion for this, and that is carried forward to our new director, Dr. Cohen. So there's real leadership support for all of these work streams. So I think that's it in a nutshell. I don't know, Carol, if you would add anything.
Oh, you covered it.
And that does make a lot of sense in terms of, you know, the moment that led to being able to dedicate the extent of the resources that CDC has. I mentioned earlier on that this would be a large feat for even a small organization. And, you know, CDC is highly matrixed and this work is large and complex. So another question for you, Betsy, you know, how did you approach this work to ensure that it was done effectively? It sounds like you've had to think a great deal about process, as well as kind of the end goal that you're working towards. So kind of how did you approach it? What's worked well and where have you had to pivot, if at all?
Great question. So we began, I think all of the priority action teams that were part of the Moving Forward initiative started with extensive listening sessions at all levels of the agency. So we got input from across CDC, and the charge was pretty clear. The themes, you know, the insights, was actually quite clear and homogeneous. And as a part of the listening sessions, but also the development and now implementation of the my lane of work, we've included scientists. It's been important to understand what trainings they've had. There's a EIS program where our scientists that are coming into the agency get some really good training. So understanding what they're exposed to and where we could build has been important. We've also included scientists in the development of the training, and as trainers, it's important for that peer-to-peer piece. So it's not just the communicators, it's hearing it from your peers. Our evaluations have been, we continue to evaluate the trainings and have had some pivots, but overall, and I have to say, I'm a little bit surprised. We've had such appreciation from the scientists. Honestly, we can't keep up with demand. We've created an online module so that we can reach more people, because we've been doing the trainings in person and we know that's not always feasible. We also know that trainings alone won't do it. There's this capacity building, team building piece. And so this champions model that I mentioned has also been a component of our work. And so hopefully it'll help us to sustain the progress and continue change within CIOs. As we began to build out this initiative, we looked into models of collaboration. I mentioned that where at CDC are pockets where this kind of multifaceted work is happening, and how can we bring that in and scale it up across the agency. So as we've unearthed things that have been particularly successful, we're building them into our iteration.
One of the things I really appreciated about your overview was just you underlining that communication is a science. It's rooted in evidence-based methods. And so kind of leaning into that in your collaboration with and engagement of the scientists, it sounds like it really stood out to me. And it sounds like it's been a particularly valuable part as well of that process. I'm going to turn to you, Carol, regarding Clean Slate and continuing this acknowledgement. CDC has a science-based culture. It's about collection and analysis of a lot of data and content. And so I'm particularly interested as you kind of balance this need for presenting scientific content with the public's clear need for clear, concise information. How in your approach with Clean Slate, how has that gone balancing the two?
I think a lot of what Betsy's team is doing to help train the scientists is going to really help our web work going forward. So it kind of everything goes together a bit. And obviously, the detailed science is important to some of our audiences for CDC.gov. So both things are important. But what we're trying to do is build in some thinking about why we're presenting content. That when I mentioned that anytime they even start to draft content, they're going to have to think about the communication goals and what the audience is supposed to do with it. And I think that's going to help us understand when we need the detailed scientific data to go up and what is the purpose for that data to go up. As well, we're trying to simplify sort of the user journey so that really all audiences will be presented with more of a summary of it, the consumer version or maybe a professional version with more information that would fire off to maybe the detailed MMWR report or whatever the other scientific background is. So making that kind of supplementary rather than the focus when someone's doing a web search and when they come into their site, we want them to find that easy version first and see the rest of the information. So I think it's something that we're going to be working through. There's also some efforts through Moving Forward to talk about how we can release our scientific information quicker and faster. And I think that will end up dovetailing into what we do for CDC.gov as well.
Yeah, I can imagine it's all like a puzzle, hopefully kind of will all fit together. Will user research and testing, will that be ongoing? I know there is some that's informed your work. Will that be ongoing?
Yes, we want user testing to be like brushing our teeth. We're going to do it constantly. And we probably tested with thousands of users already to formulate these consistent content structures that we're talking about. We're going to be testing before and after pages. We're in the middle of sort of transitioning right now. And we're going to be doing all this testing every year, every month, every week, and collecting we have a lot of data that we don't really get to time to use, but some of the automation that we're doing ought to free up time so we don't have to worry about where a link goes or what color the page is, or just some of this efficiency, I hope gives us more time to really think through the data and think about whether we need the page, if the page is performing well. So it will be part of our daily activities.
Very exciting, very exciting. And what will success look like? Have you thought at all about how you'll define that?
I'm going to be super simple about it. A site that's easy to use and communicates well. That's success, but we're going to have lots of ways to measure that.
Thank you, Carol. And, I just love how it really, to the point Betsy made even in our presentation about communication being core, to bring in early, like a part of the core team. What I'm seeing and hearing is how intricate and connected all of this is, because communication is so core. You mentioned, Betsy, in the work with the plain language training that you've been providing to scientists. I heard Carol just mention, well, that's going to actually affect the work that's happening on Clean Slate as well. I'm interested, Betsy, are there other areas that you see benefiting from the work that you're doing with scientists and the training?
Yes, definitely. And as you saw in one of the slides, our scientists are hardwired differently in terms of the training that they have. And so we're creating new norms on how to communicate and present information. And I think something that's really important that we remember here is that we prioritize scientists in the trainings for a lot of reasons, but they're a group that's responsible for studying public health problems, reporting on findings in different ways, like MMWRs, publications. They do media interviews, but they also have a major role in clearance and in the path of that information flow. So nothing leaves CDC or gets posted on the web without a very stepwise clearance and review process by experts from different perspectives. And so we want those scientists who are in the clearance chain to edit for plain language, to feel confident and efficacious in doing that, and certainly not to undercut something that is clear and they want to revert back to science speak. So there are lots of different reasons for prioritizing them, and our policy colleagues as well are an audience that will benefit from the broader online training. And sometimes in the trainings, our scientists have said, "Can I bring my comms and policy person with me?" Perfect. Yes, that's exactly what we'd like to see happen. So, and then senior leaders. I didn't mention so much about senior leaders, but the buck stops with your leadership. If your leadership says it will be so, it will be so. And so having the support that we've had, and center directors supporting the scientists and the comms within their CIO, that's been an important message and chain to invite into this as well.
It's really speaking to culture, which you mentioned earlier. So very interesting. Carol, as it pertains to Clean Slate, we're talking about various roles and how they've been affected. Betsy talked about the health communication specialist, communications, policy roles. I'm interested with Clean Slate. Has it affected in any way the health communicators' role? And if so, how?
It's going to change their roles in two major ways. One is, I hope they're more unburdened by some of the details of web publishing through this, and I'll expand on that. And the other part is, I think they're going to have more control, direction over what's going to happen with the web. I think that they're going to be able to influence what we're posting more, especially adding this communication goal thinking, the audience thinking. They're going to be more in the mix of everything that gets posted. So I think that will be a positive change. But prior to the modernization work we're doing, I feel like our health communication specialists were asked to sort of be jack of all trades. They had to understand SEO, they had to understand linking, they had to understand mobile. Even though they had web developers, they were really being asked to think about a lot. by baking some of this in for the whole agency and creating a lot of automation, when we relaunch, they're not going to have to worry about some of those pieces. And there's also some efficiency, and that health communicators can basically go in the system and edit the text directly. Before you have a change, you have to say, "Hi, web developer, will you change this sentence on this page?" And then they'd send it, and there'd be a back and forth. It should just be more efficient. So I'm hoping that saves them time to actually look at the metrics, create better health, actually do health comm and not have to do web so much. So I think that's going to be key in saving them time, but also key in that they're going to really be gatekeepers to what we're putting on the web, because there's understanding that the web is for communication.
Yeah, I really appreciated that when you talked about the user testing, right? As I'm sure many can relate to the challenges of balancing the technical requirements of the work with the desire to be strategic and actually apply what you're learning or what you have the potential to learn in communication best practices. So that sounds very interesting, and will be interesting to see how that role evolves or benefits from that along the way as well. I do want to get to some questions in a little bit, but I do want to start by asking you both a little bit about, based on where we are in the journey, what you're viewing as accomplishments or successes to date. And then we'll also talk about any challenges that you may have had as well to date. So Betsy, I'll start with you. If there's anything you haven't mentioned, feel free to share what stands out to you as accomplishments or successes to date.
Yeah, many to note. And I just want to add into the thread just a moment ago that from the communicating science clearly perspective, that communicators across the agency have just felt really excited and energized and included. And so there's a lot of great energy among communicators for thinking about the work and across all the lanes. It's never been a better time to be a communicator at CDC. There's a lot of energy. In terms of accomplishments, so many, there are many. We've had a number of successes that we're really proud of. Over the last year, we've trained almost 1,000 CDC staff on plain language, which does include the new training that I've mentioned. Our evaluations have been positive, so that helps us where we need to pivot, we've pivoted. We've trained over 400 staff on how to develop materials for people with extreme low literacy and intellectual disabilities. That's a new pocket of work for us. Within my division, I have a unit that focuses on accessible communication. And I mentioned in my talk that thinking about literacy and how people process information and what kind of information is needed for different types of people to help. This is a new area. So this has been a part of our moving forward work as well. So that's been a real success too. It's allowing communicators across the agency to feel more comfortable developing materials for people with extreme low literacy, people who understand at a third grade level or lower, which is a different kind of exercise. In terms of themes, different kinds of themes that we've heard, I would say there's just been a commitment to clear communication that is really been unprecedented. It's palpable. I think there's been a space and an appetite to innovate as well, which I think is really remarkable. And Carol, I don't know if you would add on anything different there.
No, I would agree that just one of the biggest accomplishments, I think, is just the buy-in for all of this. Especially for the web, for my part, of course, this is huge what we're trying to do, and it involves hundreds of people across the agency, and the support for it, the real interest in really truly starting over and making real change has been, I think, is a major accomplishment for what we're doing. I would also add on my end that we are on target to remove 60 to 70% of CDC.gov's content. content maybe that's not even being looked at, but we're maintaining. And that is where we were aiming for. And I'm excited that it looks like we're going to achieve that goal. We also just launched this new system and these new consistent templates. And now everyone across the agency is working, and it's messy. It's a messy time, but it's an accomplishment that we were able to kind of get the system up and running so that people can kind of get going on revamping their content.
All right. Well, we have lots of questions, which is great. It's, as we mentioned, lots of interest and enthusiasm around the conversation. So I'm looking now at the Q&A and want to acknowledge some of the questions that we're getting here. So one of the questions, there are several that are aligned around change management and behavior change as well. So just wondering, can you talk more about how you've brought along the many content producers that have historically shared info via the website to coax or coach them in this new clean slate era? So I think there's an acknowledgement in this question that while there's enthusiasm and commitment to this, right, there's changing individual behaviors and ways that folks are accustomed to working. So how have you, particularly Carol on Clean Slate, what have you had to do in order to help content producers maybe think differently in line with where you're trying to take things?
Exactly. Yeah, I can definitely address this. So I think there's two things. One is time to do what we're asking. That's a big part. They have to make time, so they need to understand what we're asking for. They also, because things were very decentralized across the agency, and people they had their thought of what a fact sheet for treatment should look like, and someone else had a thought about what a fact sheet for treatment. So they're having to let go a little bit of that individual preference in order to kind of collectively move together. And so I think what's helped is we have been communicating on this for 2 years. We do monthly, what we call the digital community, and we get health comm folks there. We have web developers, scientists come, do presentations. I have never turned down a presentation. I go and I talk to individual divisions and groups. We've been trying to do training. We had pilots of the system where people could give feedback. Clearly, there's always more we can do. And this is a hard transition, and we're kind of building it while we're about to relaunch it, because we have a pretty aggressive timeline for relaunching all of CDC.gov from when we started Clean Slate. And so we're having to build it a little bit while we're getting ready to relaunch. And we're just trying to work with people to keep them as unburdened as they can and talk about why we made decisions, how we got here as much as we're able to. But, what I think is just great is that people seem to be ready to make this culture change. I think COVID, I think maybe we were ready before, but COVID, it was hard. And I think people were ready to change their way of thinking.
Yeah. I can speak from my vantage point and the work that I've had the pleasure to do with the Division for Heart Disease and Stroke Prevention to Carol, your commitment to not just always speak to the communicators, but also offer to speak to leaders in the division and others. And so I think there's been a great effort to socialize and be willing to do whatever it takes to socialize the opportunity that is present for everyone. So I can attest to that. Are there Spanish language resources or training? Betsy, is that a question that you can answer?
That's a good question. I can double check which things we have available in which languages.
Great. So thank you. A question for both of you. How will the new website complement emergency response efforts, such as during an outbreak? I think particularly relevant given you mentioned how emergency response spotlighted it and helped serve as a catalyst for some of the work that you're doing. So that's one question. And are there plans for any quick updates as the science around a disease or an outbreak evolves?
I'll start. So yes, the what we're doing with the web is half of what we're doing is to be ready for that in next emergency. So we have thought extensively about how content is created during an emergency, how this system could support that. It's going to set us up better to have a working, consistent site from the outset. When any emergency happens, not just COVID, there's just tons of content created. It's updated constantly. And what we're building to automate that is going to make the user experience a lot better. I mentioned this earlier, there is a whole effort to think about how we can release scientific information faster and quicker. Mm-hmm. There's actually an example of some updates they're doing for respiratory season. They're issuing smaller, more frequent updates. They're just short. They're not meant to be evergreen content about the current situation. And I think you're going to see more of that on the website going forward.
Really interesting. One question that I've been wondering myself as I've been listening is there any plan, or do you think there might be a plan to subsequently publish or share insights from this journey for others that are looking to kind of learn from it, who may want to modernize their content or their operations as an organization?
Yes, I think we will. I think we will do that. We're just trying to get through the relaunch.
I get it.
It's going to take everything we got to get the spring.
I get it. Look, short answer, yes. I think there's a lot of folks on this call who will be following up. Will be interested in that.
And I think communicating
go ahead, Betsy.
Clearly, there is an evidence base for these practices. It's for just bringing the elements to our audience.
And I think there will be some great examples as well from how you're applying it that others will be able to learn from. For individuals who link to cdc.gov frequently, will the older links still direct readers to the appropriate pages once the relaunch takes place?
Yes, I'm glad y'all asked that. We will, we'll have a very smart system of redirection, but with the amount of content that we're removing, this could be challenging, but I definitely will help keep the society. Hopefully you all will be willing to share some information about some of the changes so that you can be prepared with your website. It will be a little bit of a difficult month probably to get everything straight, but hopefully our redirects will do most of the work for you.
Another question for you, Carol. Not sure if it's different from anything you've got to share, but an interesting question. We talked a little bit about what we're going from to with cdc.gov. Has there been any analysis or thought about how the site compares to the overwhelming amount of content and health information that is available on the internet beyond cdc.gov, and what it will take for that site to stand out in all of the overwhelming content that's available?
Yeah, I mean, our role is different than some of the more commercial health content providers, but we definitely considered how they're managing content, how our content is different from what they have, but we also have our mission to uphold too. But we did factor it into sort of our planning.
So there is a question. I'm going to ask it. You can feel free to let me know if it may not apply to the communication pillar as much, but as part of the relaunch, are there tactics that CDC is discussing, maybe even to leverage the relaunch to try and regain people's trust in communication, anything that may have been lost during the pandemic?
I mean, I do think this relaunch is a major cornerstone of CDC moving forward. So I think it'll be a really visible show of how we're moving forward, whereas some of the work that CDC is doing is sort of behind the scenes. So we definitely think this will be a moment to talk about what we're doing and all the changes. And I even hear currently our director mentions Clean Slate in her conversation as something that people can look forward to.
Absolutely. How do you see the role, Betsy, of plain and inclusive language? How do you see that playing a role in advancing health equity?
Really important. I think we need to be audience centered, and it's critical to understand people's experience. And when we're thinking about communicating with audiences, particularly if it's there's an emergency or a risk context, understanding, what their capacity to do the health behavior is, inviting people to wash their hands, but if they don't have running water, for example. So I think part of communicating science clearly, a key pillar is understanding your audience, unpacking that so that our communication can be centered and resonate, and that people can see. That's a part of building trust. When people see that you understand them, it builds trust.
There are a couple of questions that acknowledge the role that CDC plays in its relationship to local health departments. One specific to the site, wondering, will the new site focus on providing content for local health departments to push out, acknowledging that there's a lot now that's available for health departments, but on different places. And my dog is very interested in your answer to that question as well. Carol, not sure if you heard Bailey.
One thing that I think will help is right now to find those materials, you really have to go topic by topic by topic. But some of the automation that we're going to create is going to make it easier for you to find our communication toolkits, our resources. So I think that'll be just finding it and it being more evident where it is, and we can build some views for local health departments as we move forward where they can come to. But I think our commitment to giving health departments content is not going to change. I think we do that pretty widely on cdc.gov now.
Similar question regarding the training, Betsy. Will any of these trainings be available to health departments or other organizations?
That's a great question. Actually, I was thinking about that before the webinar. Right now, it's internal, but that's certainly something for us to think about.
Carol, since cdc.gov will have fewer pages, do you anticipate linking out to other sources more?
We do link to other government agencies now. We will still do that, but I think that'll, just as a government agency, that's a bit of a restriction for us.
We are doing good. We got it, getting through several of these questions. I think we might have time for one more. So I'm trying to see if there's one more that we could fit in for both of you regarding the plain language. Someone noticed that one of Carol's slides mentioned plainer language for the revised cdc.gov content, and they're interested in hearing more details about that approach.
Just dovetailing on what Betsy's doing, which is to train people on plain language and make things more simple. We're trying to use the system that people are going to write web content in to cue them to stay plain, to not have 8 bullets in a row, to keep things scannable. So the system itself is going to encourage it and to sort of, and the templates themselves. So I think that's what we're really focused on, is being sure everything is plain language for every audience.
Awesome. All right. Well, we are reaching the point where we'll need to transition. Before I transition to Michael, I do want to give you an opportunity. You've covered a great deal. Themes have been present along the way, which is great. There's a lot of things that have connected a couple times, but is there anything you'd want to underline, to leave the group with before we close out? Betsy?
That's a great question. What I would say is that it's a great time it's wonderful to be in an organization where, as Carol said, big change is possible, that there is space to innovate, and that there is a will to do it in this way. There are big changes, big things happening, and lots of support from the highest levels, which makes this work possible. So we're appreciative for that.
I think it's telling that was the same thing I was going to say. That's the biggest thing I would like to re-emphasize.
Thank you both for your time. And I think we have a couple of closing remarks from Michael.
Thanks everyone for that great conversation. I feel like this could have been like a 3-hour session, maybe longer. Maybe we can do a follow-up session as you continue to evolve this work. I think it's definitely an important topic, and lots of questions in the chat that we didn't get a chance to answer. So maybe we can also think about how we can get answers to some of those things and report some of those out later. I think that would be really helpful for folks. But thanks to you all for this session. Thanks also to our society organizational members and webinar sponsors, CDC Foundation and About Kind. And also a shout out to my colleague, Erica Vega, who supported on this event as well. Next slide, please, Erica. As we close out, just a reminder, I know I was putting in the chat several times, but today's session, the slides and the resources that we shared will be posted in the Society website in the coming weeks. So please share those with colleagues and friends. And then we also ask that you complete the post-event survey that should come to you directly right after from Zoom. You can learn more about the Society and check out previous webinars on our site, follow us on social, and feel free to reach out to me directly if you have any questions or want to get involved. So thank you again for joining, and take care. Bye, everyone.